With the skyrocketing cost of healthcare in Kenya, only a few people can afford the cost of treatment. That is why residents of Megun Ward in Uasin Gishua County recently had a reason to smile. They turned up in large numbers for a one-day free medical camp at KOSIRAI Primary School. The event was organized by the Kenyan-based Civitan Club in collaboration with the Wareng district health officers and nurses from Moi Teaching and Referral Hospital. The free medical services was sponsored by Miss Margareta Andres and friends who are members of Civitan International from Norway.
Today we are here to give free treatment to the community around KOSIRAI. This is Megun location in Uasin Gishua County. As Civitan International, we've been running free medical camps twice a year for the last 3 years now. In total, we have seen around 5,600 patients, and the treatment has been ranging from general treatment. We've seen dental patients, we have seen patients with problems with their eyes, and we've also treated general patients. We, as Civitan Club, we saw the need for partnering with the Ministry of Health and supporting the government in provision of health services, because as we are aware, the government alone cannot give adequate services. We've seen recently the problems with the health sector that is being faced in the country. But as Civitan Club, we are coming in to support that endeavor to fill in the gap. We have realized that we have less health professionals, especially the doctors in the field of dental, in the field of eye problems. So we are trying to fill up that gap by volunteering as a club to provide these basic services to the community. As a club in Eldoret, we are partnering with our sponsors and friends in Norway, and we are so grateful that we can have this partnership that will go a long way in helping alleviate the suffering of the patients. Most of the patients that we see are basically people from poor backgrounds, people who would not naturally afford healthcare. Healthcare in Kenya over a period of time has been going up, and most of the communities and most of the rural people cannot afford health services. We've been doing this for some time now, and we are fortunate that we are able to capture the patients from the ground and refer them when need arises, and those who are able to treat here locally, then we are able to give them treatment.
Sang, who is also the proprietor of Kenyan Medical Center in Keses, identified malaria, dental and eye problems among the leading cases that were diagnosed and treated, with a few severe cases referred to Moi Teaching and Referral Hospital.
We've done very well. As I said in my initial report, we have already seen 5,600 patients who would normally not have gotten this service. We have seen over time number of patients going down. Those people accessing dental services, for example, have gone down, whereas initially we used to have so many people with dental problems. We have also now started measuring on prevention. I think that is the area that we want to emphasize now going forward, because we cannot continue treating patients. We need to have an approach where we want to encourage health promotion, health prevention messages, so that we do not have to have patients coming for treatment, but rather we want to have prevention strategies. So far, the free medical outreach has gone on smoothly. The problem, of course, has been the purchase of medicines. As you know, is very expensive, and we are constantly talking to the government to come and support us, providing with medicines and the personnel, because paying personnel, purchasing medicines is very expensive. The other issue, of course, is we realize that we have some cultural issues that prevent people from coming to get the service. We've been just coming from talking to the young people about the use of preventive measures, like the use of condoms, and it's still a big problem because people accepting to use such measures as is still a big problem. So that is a problem that we are overcoming slowly. Basically, when we started this program, we were targeting Keses constituency, and Keses constituency covers a number of locations, and of course you know that there is a problem with finances, so we cannot cover the entire county. So we've just chosen this specific location because that is where the club is situated. But as we grow big and as we acquire more resources, then we will be able to cover the other areas. But currently we've been covering about four locations in Keses constituency.
Civitan International is an organization that aims to build good citizenship by providing a volunteer organization of clubs dedicated to serving individual and community needs, with an emphasis on helping people with development disabilities.
Half of the year here in Kenya, and that I have done now for almost 10 years. When I have been to Kenya, we have seen that there is a big problem for people to get help, health. It's about eyes, it's about go to dentist and general treatment. So through our communication with Civitan Club, Keses, we started with free medical camp. And free medical camp means for me, free is free. We are not paying anything. I am happy that I'm born in Norway. We have a country where everything is free, so we are not used to pay for anything, so we can get treatment very easily. And that I hope that some of the people also here in Kenya can have. The people in Kenya, they are friendly, the hospitality is great. So for me it's natural to give something back to the people, what they're giving me when I'm here. So as we are saying, many people ask me, oh, you are giving a lot. No, I'm not giving a lot, I'm getting a lot from the people here. So after we have started with this health program, I'm saying I have a better life myself, because the value of the life has changed. When you see that many people suffer, it's good that we can help.
It is a free service, and when we say free, it's free. we have not had a situation where patients have been asked to pay for any of the services, whether it is treatment, whether it is investigations, whether it is provision of health information, whether it is medicines. It has been free, and free. So we intend to continue this way as long as we have the support of the well-wishers. Of course, I've talked of the partnership with our friends in Europe, particularly in Norway. We intend to keep this service free of charge.
The organization is common in Europe, USA, and Kenya, and has almost 1,000 clubs around the world.
Take it. Okay.
Margrethe Andres, who is a retired teacher from Norway, stressed her unwavering support to bring health services to the rural areas, even having lost her loving husband, who was the sponsor of free medical services in the Uasin Gishua County.
As a very keen member of Civitan Club in Norway. And when he saw the group, I met the group and talked with the group in KOSIRAI, he said, okay, here we have a Civitan group in Kenya. Civitan organization is an organization who is a human, take care of people, helping people, not support themselves or any members of the organization, but help people. So it was really my husband who started, but it has been a very important part of myself also. Work was a very, very important thing for him, and me and our children, we promised him to continue with the work. So I will try as best as I can, but of course it's quite different now, and sometimes it's really tough. But I have very many good friends around here. They are taking good care of me, so I think I will.
Glasses and toothbrushes were given to the patients who were in need.
I have seen, you know, in my age, I have all my teeth myself. And I have seen around here that's a big problem with the teeth. And when I talk with the children at school, they have never brushed their teeth. So it started that in our nursery, they have got toothbrushes, all of the children, and after lunch every day they are brushing their teeth. That's important. And then we said, because we have the good dentists here, so then we said, okay, then we bring the toothbrush here and then tell the people about how important it is to take care of the teeth. It's just the elephant who are getting teeth 3 times, not we. So take care of it, that's important.
The medical camp also provided VCT services to the community members, but referred those who require specialized treatment to the relevant centers.
I have been working as a teacher for 30 years with a youngster in Norway. And a part of my teaching has been to talk with the young people about protect themselves, about condoms, prevention. So, and therefore I'm very keen also here to talk with the young people. And also to talk with the young people about not getting so many children, because the increasing on population in Kenya is destroying the country, because they cannot afford to have all these children. So it's very, very important. And of course, because of the HIV/AIDS, it's very important with the condoms. So, and you know, in my country, it's usual it's that we are talking about it. We are talking with the parents, we are talking with the children. It's common by us to talk about it. We have a new maternity in Keses, and there we are trying to give the newborn and the ladies some clothes, some equipment for the babies, talk with them. And we have also started with a private nursery, and that I hope that we can start with a new building before I leave the 1st of April. So we have projects going on, but also to help families around. We are almost finished with a house for a family of 9 people in Kabongwa, and we have started to build a small house for a lone mother with 5 children. So there is many things that we want to do and to help. And we have a very old lady baking bread, going to her. So also small things we try to do.
There is need for all stakeholders from the private, public and individual to force a strong alliance aimed at improving the social amenities in the country. Their intervention will complete the efforts of government and will indeed make a real difference in the lives of those from humble backgrounds.
After the government last year devolved the health services, it has been a bit of a challenge because, as you are aware, the sector is going through some changes, and we saw recently the health professionals resisting the health services being devolved. That in itself has given some challenges, but we are happy that we can come in as a club to partner with the government, partner with the county, and provide the much needed services to the community.
The need was to reduce. You see, we find this Africa, you find that people don't have money. And when there's this free medical camp, most people will come and get these services because it's free.
Kabaibaitu en toretet nebo takitarinik chekatoretech kocherwech kelek chekikoimech en kenyisiek chechang. Awechi kongoi mising en takitarinik ak chito nekosomwech kot komutwech takitarinik. Awekchini kongoi chichoto koibwat kot kotoretech. Alen kongoi kabisa amu toretet nekotoretech nekomakimuchi keit ole kicherunene kelek. Ako kakenyoru rani en yenekit. Alen kongoi.
Kikemian seman betusiek chechang chatkan kora ngelen kele kenam chepkondet nekilen kinemune komakimuchi kwame kityo ngon buch amami konyoiset age tugul. Kikwama keldane koik mota nelo ako mukil akot ak baka akoi. Ko nguno kelen kongoi amu toretet nekokitoretech ngimiatkan kora ko ngikasyi kekasyi iwendi kelen kongoi amu kakonekititu tugun cheu chu chekekonech serikalit kou nito. Kongoi. Ako narani yoinik chekakeamuch akere tuguk chekocham kobo akere masomoni akot boibonu akere kiy age tugul. Ko nguno kocham asomanun en loin kole lakini kakekonech cheimuchi iker ile kane ak ne cheimuchi isir ak imuchi isoman.
En ane ko kanyone amu problem nebo konyek. Ko kait ko kanyanyoru kanetisiet kot nekayama ako kakekona kiyoinik chechoto choboisie. Ko ameche awekchi kongoi mising chito nekoimutu bichu kot koit yu. Amwachini kongoi ichek amu ndama icheket takamatakiitu yu. Kakibwa yu amu problem nekakitindoi noto nebo konyek.
Kero ano ni? Amni. Kero tomo koro kero. Siyo katajo. Angyu.
Kwa vile wameweza kusaidia wazazi
kwa hii mambo ya general treatment, mambo ya meno, dental, na pia wameweza kuwasaidia kwa macho. Ninaona hata wanafunzi wangu hapa wameweza kufaidika. Hata mimi mmoja wao, mimi nashukuru kwa mambo ya general treatment. Nimetibiwa, nimekuwa na shida hapa na pale. Nashukuru sana. Sana nashukuru Margareta and other donors kwa kazi nzuri.
Alen kongo ing tayo jokoete sinyo kotoretech ingen boisionik akwai. Ka atindoi shida nebo keldet. Ko kaketoreto. Alen kongo.
Awa eng chongindo kot mising. Kimwae kele situn toe ko situnyo toretech.
Tumepata dawa. Tumekuja kujitibu kwa bure, hakuna malipo yoyote. Watu ni wengi sana, watu wamekuja wengi sana kwa KOSIRAI. Na tunashukuru nyinyi pia. Tunashukuru madaktari kwa sababu wametupea dawa. Na hasa watu wote wenye wamekuja hapa kwa KOSIRAI tunashukuru. Hasa mimi nimejipima AIDS, nimepata hakuna, hasa nashukuru Mungu. Na tulikuja na mama yangu, alikuwa anakuja kutibu kutoa meno, ametibiwa. Sasa tunashukuru na tunasema mtakuja tu siku nyingine, tunawakaribisha tena.
Toretet nebo buch nemakicheru akot tilingit agenge. Alen kongoi kabisa amu kabanda kityo kebwa ak nyekinyaech, makikoite kiy age tugul.